Hello, good morning, everyone, all participants and other colleagues. So there is a request from Dr. Nina to give her the first because she has some presentation elsewhere. So Nina, please. Age was 2178.
Good morning, all. Can you put my presentation, please? So thank you, AIOS, for this opportunity. So my topic is on strabismus surgery in elderly. Worth the trouble? Results of an objective and subjective analysis. So we know that strabismus in elderly has a significant negative impact on their lifestyle, not just on their well-being and image, self-image appreciation, but on their visual function, leading to severe incapacitation in the daily course, functional parameter performance, outdoor activities, work, and interpersonal relationships. So there is a general misconception that adult strabismus is a cosmetic condition, and if you do surgery, you don't get a stable alignment. And even insurance providers do not consider it as a functional surgery and often refuse insurance claims. So my aim was to see if to analyze the functional and psychosocial impact of strabismus surgery in elderly and to assess if the gains are functional or just cosmetic. So this was a prospective study of all patients above 60 years coming to OPD with squint or diplopia who opted for strabismus surgery from January 2022 to 23. The objective analysis was done with a complete ophthalmic workup and a strabismus evaluation. Subjective analysis was done with a questionnaire 1 week before and 1 month after surgery. Surgery was standard surgery and success was considered. There was no manifest squint with orthotropia, or there was exophoria less than equal to 16 prisms or esophoria less than equal to 10 prisms. And we did a statistical analysis after comparing the pre-op and post-op scores. So objective analysis was based on 3 parameters: presence or absence of manifest squint, binocular vision for distance using the Wurtzford dot test, and binocular vision for near using the stereopsis with Titmus fly. And maximum score was 8, indicating severe functional disability, and minimum score was 0, indicating no functional disability. Similarly, we did a subjective analysis with a questionnaire. This was a modified questionnaire from AS20 strabismus questionnaire. And we asked the patients basically about how they felt about their eyes and whether surgery was done mainly for cosmetic or functional reasons and whether they had difficulty in their daily activities. And this was repeated post-operatively and asked them about how they felt after surgery. Now coming to the subjective analysis, the scoring was similar and a maximum score of indicated 40 with severe disability and minimum 0. So higher the score, greater the disability. So coming to results, we had total 16 patients, 12 males, 4 females, mainly exotropia. You can see the age was mainly in the 60 to 70 years, closely followed by 70 to 80 years. And most of them had less than 45 prisms. Majority opted for functional reasons rather than for cosmetic purpose, and most of them had unilateral surgery. And if you look at the Wurtzford dot test pre-op, you can see a significant improvement in the post-operative Wurtzford dot test as well as in the stereopsis. So, and you can see the pre-operative objective score fell from the 6.4 it fell to post-operatively 2.25, and subjective score also fell from 14.24 to 4.38, and all these were statistically significant, indicating a great improvement in the functional parameters post-surgery. So how was the study different? We used a modified shorter questionnaire, compared both objective and subjective parameters, and showed that there were significant statistical changes post-surgery, and this surgery is very successful in not just aligning, but significantly improving the quality of life both functionally and psychosocially in elderly patients, and it has significant very low risk of complications. So that is what I want to stress. Strabismus surgery in elderly, it's not just cosmetic, it does improve their functional outcome. In today's world, with the nuclear world, with majority of the elders living on their own, they have to do all their activities like driving and doing all their activities. They must be made independent for all these things. Thank you very much.
Yeah, Nina, it was a nice presentation. Do you know whether the eyes were aligned previously? Because you're saying stereopsis has improved at the age of 70.
No, most of them had squint and double vision. That's why they came to us for surgery. So the inclusion criteria included patients with, you're asking whether it was a previous squint or a late onset squint. So most of the patients in our study were, I would say, a decompensated phoria to tropia patients. They were exotropia patients, so that was the most common type of squint.
So what psychosocial impact, what psychosocial improvement did the patient have pre-op versus post-op?
Yeah, so in the questionnaire, we asked them whether they were able to perform certain activities like, reading, watching TV, reading, working on gadgets. Some of them were employed. In fact, 6 patients were already still employed. They were doing their work. Most of them were staying on their own and they wanted to drive. So driving was a big difficulty for most of them. So post-surgery, they all found they could park earlier where they could not park. They were able to watch TV. They were able to read without closing one eye. And they were able to carry out most of their activities independently. So that was the scoring which we analyzed in the subjective analysis. So I think that was a big change.
One more thing can be included is you can give revital therapy to these patients, and it will help more.
Yeah,
post-surgery.
revital therapy is usually we do it for amblyopes.
It has many things can be improved with this.
Okay.
You can go to the Revital Stall 75 and
No,
get
I
the
have
details.
Revital Vision at my
Yeah,
center.
Yeah, so it has come out with many things nowadays.
Okay.
So even in cases, this will help.
Okay, thank you.
One small question, like, is your sample size enough to give this conclusion?
Yeah, so that is another thing. So sample size is low, but we are continuing the study. It was just a 1-year study, so we are continuing the study to see if it can be published later.
Okay, thank you.
One thing is not clear in your, like in the inclusion criteria. It is like concomitant or non-concomitant?
Yeah, so in our study we had 16 patients. So all patients were comitant except one patient with thyroid strabismus.
I asked
Comitant strabismus.
in your inclusion criteria,
Ah.
have you mentioned about the
Yes. In my due to lack of time, I didn't include in the slide. Yes. So all patients had comitant strabismus except one patient with thyroid ophthalmopathy who had an incomitant strabismus.
there is a difference?
Yeah. Yes.
Patient is concomitant. After 8 you do it at 180 year, doesn't matter. But after 50 or 60 years, mostly squints are paralytic squints.
No,
their
so-
management and things are different.
Yeah. I do understand that.